I was told that I was likely going to have my colon removed and that I probably wouldn't be able to have children. So I was given all of those messages, and it was pretty scary when you're 19 years old. And I lived through that roller coaster ride of medications and side effects for quite a few years. And then luckily I found a naturopathic doctor who helped me understand what the root cause issues were. And I addressed those things. And I changed my diet. I changed my routine. I took some herbs and just really tuned into my own body. And I reversed the entire disease process. And I went on to have, 2 healthy kids in my late 30s, early 40s. And that's why I'm so passionate, because I know myself just how amazing the body is and that it can absolutely heal when given the environment to do so.
You are now tuned in.
You are now tuned in to Let's Talk About Healing on Hindsight Media Radio 103.5 FM. Now here's your host, Yvonne Pierre.
Hello and welcome to Let's Talk About Healing, where I have conversations with guests about various topics on healing the mind, body, and spirit. Today, we will be talking about hormone health with Dr. Reena Singh, a naturopathic and functional medicine doctor. She specializes in metabolic health and women's health. She helps women lose weight, balance hormones naturally, and optimize their health for fertility and healthy aging. Please check her out on Facebook. She has a Facebook group called Metabolic Hormone Harmony. Check her out. Dr. Singh, thank you and welcome to the show.
Thank you, Yvonne. Thanks so much for having me.
Now, I just turned 50 in June. And for the past 5 years, I've been having issues with weight loss and excessive, I'm not going to get too graphic, but really excessive, heavy bleeding, night sweats, and so on. But before we get started, I want to ask, what is metabolic health? And what does it have to do with hormones and aging?
Yes, that's a perfect question. So, our metabolic health has really everything to do with our health in general, and especially our hormones and how we age, and especially as women, just how our hormones progress throughout our life. And so, let's take a step back real quick and just talk about what what our metabolism is and what that means for our health. And then I'll talk about what our metabolic health is. And so, our when we say metabolism, what does that mean? It really just means, taking energy from our food and environment and then getting it to our cells so that our cells can use that energy in order to perform all the various functions that they are performing throughout the day. And as you probably can understand, if we have 40 trillion cells in our body that are all needing energy, our metabolism and our metabolic health in general is so critical for our health. And so when we refer to the term metabolic health, what that's referring to is how well we're extracting energy from our food and from our environment, essentially, and converting that so that our cells can use it. And some of the ways that can show up in us, like how we kind of gauge our metabolic health, are things like our blood sugar. Like, when you get your blood tested and they test your fasting glucose and your A1C, that's one way of gauging metabolic health. Another way is your blood pressure. Is your blood pressure high? Your cholesterol level, your triglyceride levels, and your waist to height ratio. So knowing kind of your belly in inches and then what that compares to your height. And so all of those markers I just talked about, these 5 kind of key markers, are a way that we gauge our metabolic health. And it turns out that 88% of Americans are considered to have poor metabolic health. meaning that, in one or more of these areas, these markers I just talked about, it's not looking very good, in their blood sugar, their blood pressure, their lipids, like their triglycerides or cholesterol, or their belly fat. And so that's why it's so important.
Wow. So I know for me, I'm diabetic. I don't have high blood pressure. I have low blood pressure. So how my A1C is doing affects how I will lose or gain weight.
Oh, that's a good question. Okay, so the A1C is a reflection of the past 3 months of your blood sugar. And
Hmm.
so when you get your blood work done, they typically test your fasting glucose, which is
Hmm.
just that one point in time. So it's just that one point in the morning whenever you went and got your blood sugar tested. So that can vary. It can vary on what you ate the night before, how well you slept, your stress levels. And so it's kind of variable. And so that's why the A1C is helpful, because it's more of an average over the past 3 months. And so it gives us a better idea of how well your body's regulating blood sugar. And this is what they use to diagnose or assess for prediabetes or diabetes. And so this is probably what they looked at when they were determining whether or not you have diabetes. But here's what I will say is that I have seen in many cases the fasting glucose and the A1C to be perfectly normal, like within the standard lab range that you see on your lab work. But the fasting insulin is elevated or really high. And this is why it's so important to get fasting insulin tested, because insulin is the hormone that takes the sugar from the food you've eaten, takes it out of your bloodstream and gets it inside the cell. And when fasting insulin starts to elevate, starts to get higher in the blood, this is what we call insulin resistance. And this can be very early signs of prediabetes, diabetes, metabolic syndrome. And so even before your fasting glucose or your A1C starts to show signs of having an issue,
Hmm.
if your fasting insulin is high, then you already know that, okay, things are starting to get off the track and now's the time to step in, because there's so much we can do to help better regulate blood sugar, help better optimize insulin sensitivity, and ensure that your body is managing the blood sugar regulation, because our blood sugar and how well we regulate it is kind of the foundation for how we feel and how well we're going to age and our hormonal balance. And so this is why A1C is helpful, but it's not the whole picture. That's why I always recommend getting fasting insulin tested as well, because it can, here's why, because it can take on average up to 13 years for someone to get diagnosed with diabetes. Someone can be in that pre-diabetic state for 13 years before they actually get diagnosed. Well, we can do a lot in those 13 years to help reverse things from
Yeah.
progressing. And by having more information, like understanding your fasting insulin, we can then start implementing different food recommendations, different lifestyle recommendations that can now help to reverse what's been set in motion.
Now, I do want to talk about weight loss, but before we get into that, and I don't want to veer too far off topic, but I do want to ask how how hormones, or if hormones can actually affect if someone's already diabetic, if their hormones are thrown off for whatever reason, can that impact their blood sugars?
So everything in the body is connected. I always say that nothing works in isolation. So if one area is showing signs of imbalance or deficiency, and you already know you have diabetes, then we know that other hormones are going to be impacted. And so, because all the hormones are constantly communicating with one another and kind of determining how to keep you going, because
Yeah.
their goal is just to ensure that all your 40 trillion cells are able to function. Now, when we have diabetes, that means that there's an elevated amount of sugar in the bloodstream.
Mm-hmm.
And and so this can then influence or impact your other hormones, absolutely. And in women, especially, because our ovaries they don't get resistant to insulin. If the insulin again is elevated, that high insulin levels can then trigger a cascade of effects that can lead to higher androgen levels. And so, you know how as women age, you notice that number one, that belly fat tends to accumulate, right? It gets so
Yeah.
hard to lose that belly fat. So,
Yeah.
what's happening? Well, the insulin that I mentioned, a lot of times that's increasing because there's insulin resistance. That
Mm-hmm.
is going to trigger our our male hormones, our testosterone, to get elevated, and then that's going to contribute to the belly fat. And then it also then works along with estrogen, and both of those kind of team up, and they get higher relative to progesterone. So now we have testosterone and estrogen higher than our progesterone. And so
Mm-hmm.
this is where we see belly fat. This is where we see weight gain in the breast area, in the thigh area, in the butt area, right? In some women. So it depends what's going on in these other systems, and that'll kind of determine where the weight shows up in a woman's body. But
Mm-hmm.
if there's blood sugar imbalance, if there's high insulin, it can absolutely then trigger these other hormones to get thrown off. And then the weight can accumulate in different parts of the body. And so this is a great segue into why it's so important to address the underlying foundational systems that are supporting our hormones and our blood sugar. And what I mean by that is our foundational systems that I'm referring to are our gut and our liver and our adrenals and our thyroid as well, but I'll come back to thyroid in a minute. But a lot of times in the conventional medical system, they don't really focus on our core underground systems. But I just want to kind of briefly talk about how each one of these systems is so key for our metabolic health and our hormones, especially as we age. So, our gut health, our gut is there to kind of process and digest and absorb and process the food that we're eating and extract the nutrients from it and then release what we don't need. And so this is why it's so important that we feed our gut the food that it needs so that it can do its job, because we have more gut bugs inside of us than we do human cells. Isn't that crazy?
Yeah.
So we have we have 100 trillion gut bugs, and they all need food. And the food that they need, they will like fiber. So our gut bugs need fiber, and then it takes that fiber and it creates uh, short chain fatty acids, which then create these nutrients, and all of these nutrients that can then impact how well we metabolize our hormones, how well our blood sugar is balanced, and then it communicates back to the brain in terms of how we feel mentally and emotionally. So this is why, sometimes you'll hear that our gut is truly our the foundation of our health and truly our second brain, because many of our brain hormones, like our neurotransmitters, actually come from the gut first. And so this is why really feeding our gut and nourishing our gut with the food it needs is so important. And also ensuring that we're eating the right foods and we're not constipated and we don't have gut issues and we don't have gas or bloating or acid reflux, because any of those signs or symptoms are an indication that the gut is not so happy. And so it's definitely a place to start, because our hormones and our metabolic health depend on a healthy gut. And the gut and the liver are really good friends. And our liver is another key organ that is responsible for, again, metabolizing our hormones, processing things, and getting rid of the things we don't need. And so the gut and the liver are integral with hormonal balance, because especially as women, we're breaking down our estrogens, and we don't want the bad estrogens to get recirculated. And this is why having good, healthy gut bacteria, having a liver that is not inflamed, that is not congested, is so important, because it will allow our hormones to get broken down and move through appropriately as they're supposed to. But if there's issues in any of these systems, it can back things up. And then that's when it can show up as signs, as hormonal imbalances, like night sweats and hot flashes and heavy periods and all of that. But we got to go deeper. We got to fix the underground, the root cause. And that starts with the gut and the liver, as well as the adrenals. And so our adrenals are these two little glands that sit on top of the kidneys. And that's where all of our cortisol and other type of, stress type hormones are produced. But if we're constantly living in a state of stress and our poor adrenals are constantly pumping out cortisol to get us through that day, or that, all these stressors, it then pulls away the resources to focus on our hormones and hormonal support. Because as we age, and especially as women, when our ovaries stop producing our hormones like they used to, the adrenals are supposed to take over. They're supposed to help take over and make estrogen and progesterone for us. But if we've been living, decades under a lot of stress, and our poor adrenals are just like done, they're just so burnt out, they don't have anything more to give. And so that, again, you'll have signs and symptoms of hormonal imbalance. And some women will think, oh, well, let me just go, let me start taking hormone therapy. And I'm not saying that's a bad approach, but I'm also saying that it's ignoring the foundational systems that need to still be nourished and addressed and optimized, because they still need to be healed and brought back into balance, so that it can do what they're meant to do, instead of just trying to have a top-down approach, if that makes sense. We want a bottoms-up approach where we're really healing and fixing in that foundation and nourishing kind of the roots, if you will.
So is this the connection, when you talk about hormones, are we specifically talking about, as far as weight gain for women, is it specifically from menopause, or could it be other hormonal issues?
Oh, absolutely. Yep. It can be other hormonal issues, and in younger women as well. And so PCOS, I'm not sure if you're familiar with
I've
PCOS.
heard of it, but for those
Yeah.
who haven't, what is it?
So PCOS stands for polycystic ovarian syndrome, and
Mm.
it is the number one endocrine disorder that women struggle with, and it is the leading cause of fertility issues. So it's a huge issue. And the more we're learning about PCOS, we now know that the root cause of PCOS is largely due to poor metabolic health,
Mm.
meaning that we have elevated insulin, we have poor blood sugar regulation. That then leads to this insulin resistance inside of the ovaries. So then that leads to the elevated testosterone. And that's why women with PCOS tend to have more issues with weight gain and hair loss on their head and hair growth in other parts of their body, and they don't ovulate well, and they have fertility issues. But if we take a step back and think about the big picture and what's going on, it's this metabolic piece. And again, what's underneath that is understanding and knowing what's going on with their gut and their liver and their adrenals and blood sugar balance and inflammation as well, if there's any inflammation going on.
So if someone feels that there's something going on, like, for example, when I was having the heavy bleeding, I usually have very mild monthlies, and I usually don't have cramps and all that stuff. But in the past few years, it got really bad, to the point where, and plus like I mentioned earlier, my blood pressure runs low. So because it runs low, and then I was having the heavy bleeding, at one point I passed out because it was affecting it made my blood pressure drop. So, and I became anemic because of all the heavy bleeding at the time. When I went to my OBGYN, because I was having so many complications, I couldn't get, my tubes removed or anything like that, nothing evasive. So I was given an IUD as the solution to stop the bleeding. But what are some alternatives other people can do, before we get into what can help them through the process? But as far as hormones and heavy bleeding and stuff like that, what should they immediately do?
So, well, kind of two parts to this question. But first of all, I'm so sorry you had to go through that. But it's also a great example of things that were likely out of balance for quite a while, and then as as we age, as women age, and we have these hormonal fluctuations as well as a decline in many of our hormones, and then kind of our body's now pulling on other systems to try to compensate, it can create this huge kind of imbalance in all these different areas. And so once it gets to that point, yes, you need more interventions once it gets to that point. And so that was likely a good step for you. Now, are there things you can do now at this point to help the foundation? Absolutely. And that's what I would recommend as well. So that's the other part of this, is that my whole goal is to help educate women that we're always in a constant state of hormonal fluctuation, if you will, right? From the time that we start having periods during puberty up until the time that we cease to have periods at menopause, our hormones are constantly communicating with one another and dependent on our foundational systems. And so the most important thing that we can do as women is to support our foundation from day one. And because starting in our teenage years, late teens, early 20s, and understanding this connection between our gut and our liver and our adrenals, and how that impacts our thyroid directly, as well as our hormonal balance, that will then support our body when we are trying to get pregnant, and then later when we're transitioning from perimenopause into menopause. And so what it sounds like is happening is what I talked about before, is that there is a huge need for blood sugar balance, decreasing inflammation, supporting your gut bacteria, and clearing out the congestion in your liver. That would be my approach for the majority of women who come to me with any sort of hormonal type of symptoms that they're having. Because that IUD, that birth control pill, any of those medications or interventions are not treating the root cause. They're trying to Right. And there's absolutely a need for that. I'm happy
Yeah.
that we have that because obviously we needed to do something, but we have to remember that is not addressing the root cause. So don't allow that. I guess my message would be is to continue to work on your health, and the underground systems would be the message, because that those aren't fixing it, and we want to ensure that your underground systems are getting nourished and optimized as best as they can to continue to support you as you age, because as women, that's what we want. We want healthy aging. We want
Yeah.
hormonal balance and healthy aging into our later years, because we now also know that poor blood sugar regulation, poor metabolic health, high insulin can also be one of the factors that can increase the risk for Alzheimer's and dementia and specific cancers,
Yeah.
right? And so this is why knowing what your metabolic health is, understanding where your specific imbalances and deficiencies are, which systems are involved, is so important. And addressing those and kind of getting things back in line and cleaned up and optimized and nourished. That's the goal.
Now, I had a heart attack in 2017. But what I started doing is I changed my diet, so I eat mostly vegetarian. But I also started at least once a year. I would cleanse. Now I cleanse when I feel my body needs to be cleansed. So I'll do a detox and eat mostly raw fruit and vegetables and all that stuff, to kind of help my body heal from the inside, as you were speaking. That was one of the things that was important to me, was to research and see how I can heal the liver and the gut, and taking milk thistle and things like that. So primarily, the three things, just to be clear, the three things that women should do to support their body, is that what you were speaking of?
Ideally, don't wait for a wake up call.
Okay.
That's
Right.
something major, right? let's
Yeah.
let's shift this message. I would love for women to start thinking about their health when they, in their teens, in their 20s.
Yeah.
And because as women with hormonal fluctuations on a monthly basis, we have insight into what's going on with our health. So our cycle is now considered the fifth vital sign, which is so profound. So
Mhm.
when we as women start having issues with our cycle, heavy bleeding, no period, not ovulating, fertility issues, severe debilitating pain with our period. All of these are signs or indications that there could be imbalances going on. So let's not wait until it shows up as another major sign or symptom and
Yeah.
then we start doing something about it, right?
Yeah.
All of those are already indications that there's something going on. And so, what I would say is number one, find out where your specific imbalances and deficiencies are, because it can be different for every single person.
Mhm.
No two people with the same exact symptoms will have the same imbalances in the same systems. Some people, their inflammation may be off the charts. The other person, it's all in their gut, like they have severe gut imbalances. Somebody else, it's more in their liver. Somebody else, it's massive blood sugar dysregulation or high insulin. I don't know. So that's why it's so important to find out and get an assessment of what's going on in your body. And there's different ways to do it. The way I do this is I have a tool called the blood work analysis, because everybody has to get blood work anyway.
Mm.
So I recommend getting really good comprehensive blood work and then going to someone like me who does a naturopathic or more functional medicine type analysis of your blood work, because I look at your markers, your results differently. I compare them to optimal ranges, not the standard lab range on the report. And I look at certain markers together, which gives me insight as to which systems are showing signs of imbalance or deficiency. That's where you start. That's where you know, okay, where do you focus your attention? What do you need to do? And then, yes, do what your body is asking you to do. Is it cleaning things up? Is it balancing blood sugar? Is it decreasing inflammation? Is it, feeding the gut better? Is it a huge, and another big piece to all this is really supporting the nervous system. So our
Yeah.
nervous system is like the antenna to the outside world, and
Hmm.
it's constantly assessing, saying, "Oh, okay, is Yvonne, is she in danger right now?" Like, right? Because back in the day, our danger was running away from a tiger. We were getting chased.
Right.
Today, our dangers are, oh my gosh, you're sitting in traffic and you're 30 minutes late to pick up your kid, or you haven't, you have 100 emails in your mailbox that need to be checked, or you have a crazy meeting at work which is causing you stress. So we have different stressors today, but the impact on our nervous system and our adrenals is very much similar, and that's what pulls us out of our calm parasympathetic state into a sympathetic state. And when we get shunted over here, that can impact all of those foundational systems that I talked about, because now the body's in the stress mode and all it's trying to do is protect you and keep you alive, essentially. And so then it's going to divert its resources from healing and repairing to keeping you safe and alive, because that's all it thinks, that you're in danger. And so our job is to constantly send that message back to our nervous system, like, no, I'm good. I'm good. Yeah, there was that blip, there was that stress, that's expected, but nope, now I know how to get back to a calm parasympathetic state. And what are some of those tools, right? That's really watching our breathing and how we're breathing and where we're breathing from.
Mm.
If we're taking shallow breaths all day long, and we're breathing from our upper body and not from our belly, that's an indication that you're in a sympathetic state. If you're breathing through your mouth more than your nose, again, you're shifting into a more sympathetic state. We need to be breathing through our nose.
Mm.
We need to ground our nervous system. We need to connect with the earth. We need to walk around barefoot on sand, in grass, and really connect with the earth. We need to get morning light. That morning light. We have receptors in our brain that really need that light to help shift the hormones. It helps shift the switch between melatonin and cortisol. So all of these signals, how we interact with our environment, how we're breathing, how we're sleeping, all of this is impacting our metabolic health and our hormonal health. And so that's why it's all encompassing. It's our food, it's our daily routine, and it's our environment. And it's this supporting our nervous system, which is constant.
Yeah. This is really good. I'm sitting here taking notes.
Oh, good. I'm so glad. I'm
Thinking
so
about
glad.
all the stuff, because most of the issues that I've dealt with, the inflammation and the adrenal, because I was a heavy, heavy coffee drinker. I want to shift gears for a sec. It seems to be a lot of women. I don't know if it's an issue or if more women are publicly speaking about it, but there seems to be a struggle with fertility these days. Why are so many women struggling with their fertility?
Yeah, I love this topic because, oh gosh, I work with so many couples that come to me who have either tried IVF and it's failed them many, many times, 6 to 12 times. I've had couples,
Mhm.
try to go down that route and it just hasn't worked for them. Or I have many people come to me who are trying to prevent going down that road. And what I will say is that for all of these couples is that it all boils down to their underground systems, their metabolic health for sure,
Mhm.
and their nervous system. Because a lot of times what happens is they'll try to get pregnant, and after 6 months, they'll go to the doctor, and then after a year, they're considered, um, unexplained infertility,
Mhm.
if they can't find anything else wrong, and then they'll say, okay, well, medications or IVF, that's your next step, because they can't find anything wrong. But the reason they're not finding anything, quote unquote, is because they're not digging deeper. They're not looking at the foundational systems. And so when a couple comes to me, and you're right, it's what out of like 5 couples struggles with fertility? That's huge.
Yeah.
And it's a combination of factors. So like I mentioned, PCOS, right? PCOS is the number one endocrine disorder.
Mhm.
Sperm counts have dropped astronomically over the past 40 years. It's dropped by over half. And so we have huge issues with quality, the egg quality, sperm quality, as
Mhm.
well as ovulation issues. And all of these things boil down to metabolic health and then our foundational systems. So, what is going on there? And that's all I do. I just take a step back, I help them identify, oh, okay, here's what I'm seeing, that you're not digesting and assimilating your nutrients. So these people come to me on like 10 different supplements. But those supplements can't do their job if your foundational systems are unhappy or imbalanced. We have to start there first. So we have to fix the gut. We got to make sure the liver's happy, decongest. Again, shifting the nervous system back from sympathetic to parasympathetic,
Mhm.
getting blood sugar balanced, getting that insulin levels down, getting inflammation down. That's how we optimize hormones. That's how we bring fertility back. And that's what I've seen over and over and over. I think just this year, I've had, gosh, almost 30 couples get pregnant after we started
Wow.
working together. I
Wow.
mean, yeah, it's a lot. It's amazing. The body is so beautiful and amazing. It just wants to be nourished and supported. And a lot of times we're, we we're just so kind of trained to think that, to ignore the foundation and just go to more interventions like
Yeah.
medications or interventions that are are a lot more significant
Yeah. It's
impacts on
like
the body that aren't.
and it's like
Yeah, because
treatment.
we're
Yeah.
ignoring the basics. And
Yeah.
let's just go back to basics. Let's really
Yeah.
just address the foundation.
I was
And
just thinking that everything
yes,
that you're saying is what, you know, we should be doing since, at the beginning as children, eating the right foods and exercise and, making sure that we're feeding ourselves the right foods. But me growing up, a lot of our, my grandparents and my mom, and they didn't, health wasn't as big of a topic
right, right.
growing up, and especially with my grandmother's generation, um as far as the eating unhealthy, and even though they ate meals and not fast food, but you know health wasn't as big as far as eating natural foods and eating apple and raw vegetables, and we got away from eating healthy, or or maybe I should rephrase that. We're getting to learning more and eating healthier, more so. I see it more so now than ever. Seeing people being a little more health conscious. You mentioned metabolic health. Other than how we feel and symptoms that we see, is there a specific test, or are we strictly looking at the symptoms?
No, that's a great question. It's a combination of both. So let's talk about the blood work first. So the blood work, what you definitely want to get tested for is your fasting glucose, your A1C,
Mhm.
and your fasting insulin. So you definitely want to get those tested for sure. And then you also want to get your cholesterol and your triglycerides tested. Now, most of those are pretty common and they'll be included. The only one that's not is the fasting insulin. You really have to ask for that and push for it.
Yeah, because I've never got that. I don't think
I know. I don't know why they never tested. I run it on every single one of my patients or clients.
yeah, I get an
Uh,
A1C, but this is
yes,
my first time.
get your fasting insulin. I bet you it will be enlightening.
Okay,
It's good for everyone to get, for
okay.
sure. So in terms of blood work, and then also your inflammatory markers. It's really good to get
Mhm.
an understanding of how much inflammation you're dealing with.
Yeah.
I and so it would there's many markers, but the ones I recommend getting done are things like your SED rate and your HSCRP and your CRP, which stands for C reactive protein, as well as homocysteine and maybe fibrinogen. So all of those are good markers to get done to just see what's going on and if there's inflammation playing a role. Because I have seen that in so many cases where it's the inflammation that is inhibiting weight loss. And
Mm,
it makes sense too that inflammation would, lead to joint pain and just achiness. So it's good to know what's going on.
yeah.
And there's other markers in the blood work as well, but when it comes to metabolic health, these are the ones that you definitely want to know. And of course, the complete thyroid panel, and and so that in terms of blood work, that's what I would say.
Okay.
And then blood pressure. It's really important to know what your blood pressure is. That's
Mhm.
another key marker for metabolic health. And your waist circumference compared to your height. So you want to measure your waist and then you want to double it and you want to see how that compares to your height in inches. And if it's more, then that could be an indication.
Mm.
And then of course symptoms that you're just feeling on your own, if you have belly weight, if you have stubborn belly fat, if you have a hard time losing weight, if you have brain fog, if you're kind of having a hard time with memory and things like that, those are all indications that there could be an issue with your metabolic health.
Wow.
Yeah.
Okay.
So it's a combination of really understanding what's going on in your blood work as well as tuning in to your signs and symptoms.
Mm. Okay. So, what can be done to support fertility naturally? Mhm.
Well, I'll say for fertility and hormonal balance in general, it's
Mhm.
it's it's all the same in terms of the foundational piece.
Okay.
It's it's balancing blood sugar, it's ensuring that your insulin is nice and low, and it's making sure your gut is super happy. So again, when it comes to the gut, we look at markers in your blood work to give me an idea of what's if you're digesting and absorbing, and then I also listen to your symptoms. So if you have any symptoms of constipation, diarrhea, acid reflux,
Mhm.
gas, bloating, nausea, vomiting, anything like that, it's like, oh, okay, something's going on there. So then we have to address the gut. Liver, if your triglycerides are high, if your cholesterol is high, if you have markers in your blood work like your AST, your ALT that are elevated, those are all indications that the liver is not happy.
Hmm.
Yep.
Yeah,
I've
and
seen
that's
I have
dangerous.
seen that happen so
Yeah,
many times in
yeah.
women when they'll come to me, and that's all I've done is like clean up their liver, decongest some things, and in 3 months she was pregnant. Uh,
Oh,
and so sometimes it can appear to be the simplest thing where unfortunately they've been kind of run through the ringer with other stuff, but the body just wants to get back to a state of balance and just have all the systems working as best as they can. And a lot of times they're not, just because of our environment nowadays and our routine and our lifestyle, and the quality of our food is just not the same as it used to be. So we have to be more diligent. We have to be more put more focus on what we're eating, the quality of the food we're eating, when we're eating, how well we're sleeping. All of these things play a role with our metabolic health. All of
mm,
it.
yeah. I can go on and on talking to you. I really love talking about stuff like this. But tell us about your services and what you offer and how people can get in touch with you. And do you work with people virtually?
I do. I do. I work with actually my whole practice is virtual. So
Oh,
I only see people virtually now. So that is so that works out. But yes, I would be happy to. So my background, I am a naturopathic doctor, and my own health issues led me into becoming a naturopathic doctor. I was diagnosed with ulcerative colitis when I was 19. I was told I was going to have to take medications the rest of my life. I was told that I was likely going to have my colon removed and that I probably wouldn't be able to have children. So
mhm.
I was given all of those messages, and it was pretty scary when you're 19 years old. And
Yeah.
I lived through that roller coaster ride of medications and side effects for quite a few years. And then luckily, I found a naturopathic doctor who helped me understand what the root cause issues were. And I addressed those things. And I changed my diet, I changed my routine, I took some herbs and just really tuned into my own body. And I reversed the entire disease process.
Mm.
And I went on to have, two healthy kids in my late 30s, early 40s, and that's why I'm so passionate, because I know myself just how amazing the body is and that it can absolutely heal when given the environment to do so. And and so that's my goal. That's how I work with people. I really, my goal is to address the root cause. And I have a metabolic, I do have a metabolic hormone reset program,
Mhm.
which is a 12-week program, and it provides all of the food, the dietary guidelines, as well as the lifestyle and the support to nourish and support all of the systems that I talked about, because those are just as important as the food. And then it also includes the blood work analysis that I use to assess, to see where your specific imbalances and deficiencies are. And and so it's a nice, just kind of comprehensive little program or package that
Yeah.
helps to just get everybody back on track. So if you have any signs or symptoms or are struggling with any type of metabolic health issues, which 88% of Americans are,
Yeah.
then it's a really good place to start.
Yeah.
And and then I have a separate kind of fertility program. And so then if there are couples who are struggling with fertility, then I work with them and really dig deep to figure out, okay, what's going on, and provide them with the support and whatever herbs, remedies, whatever else that they may need to help get them to a place of optimal health for optimal conception and pregnancy and baby.
Yeah. So how can people get in touch with you?
Yeah, I think the best way is to join my Facebook group, because I go in my in my Facebook group, I go on there regularly, and I do short little talks. I do presentations on a variety of these topics that we talked about today. And and so on Facebook, and I'm sure you can provide the link hopefully,
Mhm.
it's Metabolic Hormone Harmony, and then it's a group, and you just have to answer a couple of questions and you're in. And then my website is called zamawellness.com. And I can provide those links for you. And yeah, I would love for your listeners to join and just, listen and get the information that they may not be getting elsewhere, so that way they can be more informed and get the appropriate blood work that they need done, and take it from there.
This was really, really good, Dr. Saying this. I thank you so much for joining us. This information, I'm sitting here still processing
Oh,
all,
I'm so
all
happy. I'm
the
so glad it was
information.
helpful.
Because I strongly believe that everything starts within, as far as our health and being healthy, and it impacts everything, our heart, our mind, our everything, by what we're eating and what we're, and how we're treating our body, naturally. So I thank you again for sharing this helpful information. Thank you for joining us, and I wish you nothing but the best, and maybe I can have you back on at a later date.
Thank you so much. I loved it. It was a great conversation, and absolutely, we will do this again.
Yes, thank you. And to our listeners, I would love to hear from you. In the comment section, let us know how you've been able to heal and tell us your story. Thank you so much for tuning in to Let's Talk About Healing. Be sure to follow, like, share this with anyone you feel needs to hear this. Look, you owe it to yourself to grow and heal on purpose. Until next time, be blessed.
Thank you for tuning in to Let's Talk About Healing with Yvonne Pierre on Hindsight Media Radio 103.5 FM. We hope you enjoyed the show. Be sure to subscribe, like, and share.